Hi, I'm Dr. Richard Ruhling, here to share with you on how medical care is not health care and how the pharmaceutical companies are killing us. I'm referring to a recent article posted on livetradingnews.com citing the CDC, which says that 91 Americans each day are killed by opioid drugs. And that article there cited the pharmaceutical companies as giving $48 million to 68,000 MDs for their prescriptions to opioid drugs. And question is, how important, how necessary, do we really need to do this? Okay, it's a bad thing to be paid by pharmaceutical companies for your prescriptions. Number one, that's a bribe, and secondly, it doesn't have to be that way. I personally, speaking from experience, working in a pain clinic for a week when another doctor was on vacation, and I had everybody walking through the door wanting a prescription for a hydrocodone or Xanax, okay? All addicted, and they thought if they didn't have the medicine, it hadn't healed, they would have the pain. Well, it's bad prescribing practice, in my opinion. Typically, a man at work might be trying to lift something, hurt his back, go to the doctor who x-rays. I once commented to I was in the emergency room and an orthopedist was standing next to me as I looked at some back x-rays. I said, I don't see anything. He said, well, I don't either. I said, he said, in most cases you don't. If you really want to see something of value, you inject the dye into, they do a myelogram, okay? Well, the standard lumbosacral spine series doesn't show anything 95% of the time, probably. It's money to the system for, but it makes you feel like, well, you checked it out. But these people are given a prescription for something for pain, moist heat, lay in bed, take it easy, and get back to work when you can. But the problem is, with opioids, it feels so good that you feel like you can handle the work. You go back to work and you do things you shouldn't be doing yet. It's not healed yet. And bottom line, you can't stop that medicine. If you stop it, you get the pain again, okay? Not good, and millions of people are addicted from poor prescribing practice. I can honestly say that I never initiated such a prescription. In other words, if they weren't on it before, I didn't give it. I gave Tylenol with codeine, or that's an opioid, by the way, but very low habit-forming likelihood compared to hydrocodone, OxyContin, and that kind of thing. So, situation is not good, and I have gotten around it by giving other prescriptions. People can live in pain a little bit. I give you a personal testimony. I was in New York City and stepped out from behind a dumpster. The street was silent, it seemed like, but a taxi cab was coming, and it hit me. I woke up on the street. Crowd of people around me. They said they called an ambulance. I didn't want to go to the hospital. I was supposed to work the next day in an emergency room myself. I stood up, almost fainted when I stood up, but I told them I was okay, and I limped off. I had pain in my leg, and my knee felt like a pumpkin. And I did see an orthopedist, friend of mine, colleague, and he x-rayed it. I did have a fractured. It was the lower leg, the side bone called the fibula, which was kinked. It looked like well, kind of like this, okay? So, bottom line, I had a fracture, and it pained me at night. It would throb because I had developed a phlebitis. Apparently, so much blood vessel had burst, my leg looked purple, and the knee was the size of a cantaloupe, and I'm a little guy, so not good. But throbbing at night, I didn't know what to do exactly. And this is just for interest because of people who have problems like, for example, this would apply to people with diabetics, okay, with an ulcer on their feet. They're about to lose their foot, they amputate. Well, in my opinion, if they were to do what I did, I got a small trash can, high though, tall, and put my leg in that trash can, filled it with hot water. Now, a diabetic could not take real hot water. They can only take about 105, 106 at the most, because their microvasculature does not, and their nerves don't sense the heat. So measure the temperature, 105 or 6, I soaked my leg in probably hotter water than that, maybe 110, for about 3 to 5 minutes, lifted my leg out, and put a cold wrap around it, wrung out of ice water, okay, really cold. But what that does, the hot dilates the blood vessels, the cold constricts it. Hot dilates, cold constricts it. This is vascular gymnastics, opening and closing blood vessels. Each time you open and dilate in the hot, a new fresh blood supply with healing factors comes, and 3 minutes later, after the hot water, you constrict it and send that waste products away for a new fresh blood supply. So really good pain relief, and my leg was eased, and I could sleep better the next night. And the third night, hey, getting better, you know. So living in pain, yes, pain is not the end of the world. It's just telling you don't do that. There's tissue damage. So when people go back to work and they start hurting again, hey, don't do the lifting yet. Not able to. We need to learn to lift with our legs, not our back. But bottom line, I've had personal experience not prescribing, and people, if they really want those habit-forming drugs, they can go somewhere else, basically. But this does not have to be done in this country, and the pharmaceutical companies are as guilty as hell, in my opinion, for paying doctors to write prescriptions for such habit-forming drugs with such a propensity. So I hope you like this, find it interesting. Don't look for Congress to change anything anytime soon. I went through the U.S. Congress Senate offices talking to senators or their aides, and until one senator said, you know, you're wasting your time. They own us. Speaking of the pharmaceutical donations to their re-election. So, bad situation in this country. Dr. Marcia Angel, who was editor of the New England Journal of Medicine, told 60 Minutes that the drug companies give $400 million a year to re-election campaigns for Congress. What a bad situation this is. That should be outlawed, and Congress should take the same medical care system that we get, and if they want Obamacare for everybody, they should take it too, etc. Make it equal, and bottom line, we can do better getting real health care, and I have a website that shows a better evidence of what real health care is, not Obamacare. If you like to go, it's richardruhling.com. It's my website, and at the bottom is another video that you might find of interest, supplementary information to what you've heard here. Thank you for taking the time. God bless you. Look forward to seeing you.